The term diabetes mellitus describes diseases of abnormal sugar metabolism resulting in high sugars. It is associated with reduced insulin secretion or resistance to the action of insulin. There are four common types of diabetes. Number 1, type 1 diabetes. Number 2, type 2 diabetes. Number 3, diabetes in pregnancy, which is also called as gestational diabetes. And number 4, diabetes due to medicines. We'll talk about type 1 diabetes first. Type 1 diabetes is due to destruction of pancreatic cells that produces insulin. This is usually due to autoimmune destruction of the beta cells, that is, body forms antibodies that target these pancreatic cells. Next, we go to type 2 diabetes. Type 2 diabetes is by far the most common type of diabetes. It occurs due to insulin resistance, that is, insulin is unable to do its job properly. This is the most common type of diabetes in adults. There are many risk factors of type 2 diabetes. Number 1, family history. Compared with individuals without a family history of type 2 diabetes, individuals with a family history have a 2 to 3 fold increased risk of developing diabetes. Number 2, obesity. The risk of type 2 diabetes rises with increasing in the body weight. Number 3 is lack of exercise. A sedentary lifestyle lowers the energy expenditure, promotes weight gain, and also increases the risk of type 2 diabetes. Next type of diabetes is gestational diabetes, which occurs when a woman's pancreatic function is not sufficient to overcome the insulin resistance created by the anti-insulin hormones secreted during pregnancy. This usually occurs after 24 weeks of pregnancy. The last type of diabetes is drug-induced diabetes. A large number of medicines can increase sugars. They act by decreasing the insulin secretion or causing resistance to the action of insulin. The most common drug that does this are the steroids.